Wonderful. Can't believe it's already week 3. It's almost July. So, I want to talk about neuropathy today. It has come up since the beginning, and I think acupressure could be somewhat helpful. So, it's a few more points than we usually do over the last couple weeks. So, bear with me, and let's see if we can get through the whole protocol. Quick review for those that are new. Let's see if I can get this to work. There we go. I'm Jackie LaCava. I'm an acupuncturist. I'm in Phoenixville, Pennsylvania. I'm in my office today. I'm in a different area than I was before. We're renovating the downstairs. But this is good because I'm on the ground, so you can see how to do acupressure on the ground this week. Previously, it's been from my office chair. All of the previous weeks are available online. Week 1, we did a research-backed protocol for fatigue that I use with a lot of patients. Last week, we worked on adapting that protocol for nausea. And this week, we're going to adapt that protocol for neuropathy. A quick review on method of acupressure. Find a place that works for you. For me, the last couple weeks, I've been at a desk at my chair. This week, I'll show you how to do acupressure on the floor. You also could do acupressure in your bed, on your back too, is not a bad one. Wherever you are comfortable for, say, 20 minutes is fine. Once you start doing an acupressure protocol, we like to have you start from the beginning and the end fully, just like if I was doing acupuncture on a patient, I wouldn't do one point at a time and then they move around. We do all the points, you rest, and then we take them out and you move on. So we like to do all the acupressure at once. Let's talk about the pressure. So with acupuncture, I'm using a needle. With acupressure, you're using your fingers. So either an index or your thumb. I didn't bring a pencil upstairs today. Wait, nope, I might have one. You can also use a pencil. Okay, pencil, helpful. I like these with like a nice, I don't know if you can see, like a nice thick eraser. You can also get those little eraser toppers, the chunky ones. Those are great too. But if you find, like today, you'll notice there's a few points on that are closer to the ankle and the feet. If you can't get to those points, pencil is helpful. So you can use your thumb, you can use your finger, you can use a pencil. The other reason I have people use a pencil or a thick eraser is if you have neuropathy in your fingers, sometimes it's uncomfortable to press a point. So using this is a way to do that without hurting your hands. You can also use a partner or a friend as well if some of the points are hard to get to. Pressure should be applied for about 1 to 2 minutes per point. I try to do 2 minutes when we're going through the protocol here. I'm a little spotty. I'm trying to keep an eye on the time and an eye on the protocol. But you could set a recurring timer on your phone and then just move points every 1 to 2 minutes. With acupuncture, we're usually treating both sides at once if it's a point that's on both sides. With acupressure, we try to focus on one side and then the other side. So if we walk through a point, say stomach 36, which in acupuncture, I might needle bilaterally at the same time. Acupressure will press one side and then we'll press the other. The pressure on the point should feel firm. It should not feel painful. A question that I think came up last week and the first week was varying degrees of discomfort. I feel a lot of tingliness down my leg when I'm doing the points, or you don't want to press enough so that, say you have a bruise the next day, you want to give enough pressure that you feel it. Now, we're treating neuropathy today. So sometimes when you're pressing the points, you will feel a tingliness or like a nerve sensation down the channel or in the area. I feel like that's normal as long as it's not uncomfortable for you. A lot of this is patient led by comfort level. So I guess a summary would be patient comfort led. This is not a no pain, no gain situation, if that makes sense. Okay. Treatments are done every day, once a day. Yes. If you can, try to work this into your, daily, whether it be your wake up routine, your bedtime routine, your while you're watching TV routine. Once a day is going to be optimal for things like neuropathy, which is a longstanding condition during and post treatment. Then again, for say last week, my recommendation with my nausea protocol is use it when you need it. You don't need to be using it preventatively a lot of the cases. But neuropathy is one of those things that, yes, you will need to commit to doing it once a day for a period of time. Okay. If you have any questions about that, feel free to throw it in the chat. Rachel's been great about interrupting to, moderate comments that we should answer now. If not, I answer them next week or, in between. This week so the original week 1 was this protocol. It's based on a research article that came out in 2016. They found this protocol was very helpful for cancer-related fatigue. So what I've been doing is using this protocol as a foundation. So we modified it last week. This week, we are removing a couple of the points. So the points that were on the back of the neck, the last 2 weeks we've been doing that point. We are not this time. We're keeping this point. We're also removing the point on the wrist. And then we're adding 3 new points, the channels of which I have here. So on the right side, we've got the stomach channel. The stomach channel starts all the way up at the eye and then goes down the chest and down the front of the body and ends at the toes. And then large intestine channel comes up the arm, up the neck, lymph nodes, up here, and then ends right here over the nose. Both really good channels for neuropathy of the upper and lower limb. All right, so what I have done is put all of the protocol on one slide. And for those of you that are adding questions about different conditions, awesome. I think there was one about lymphedema in there. Acupressure on affected lymphedema arm. Yes, you can use acupressure on lymphedema arm. However, from having lymphedema, you need to be gentle with that arm. So I typically don't recommend that people are using like serious pressure, like pointed pressure, like with a pencil. Just gentle index pressure is fine. And I do have some people do acupressure over, say, their garments, like if they're wearing upper or lower garments, that's fine. And acupuncture wise, we're typically not doing acupuncture on the affected limb. So acupressure is a good secondary treatment. Okay, so we're going to start as we have the first couple weeks on the top, and we are going to work our way down. And you can choose to do left side or right side first. It is up to you. It's about 209. Okay, so we'll do 210. Okay, so we'll try to do 1 to 2 minutes with each of the points. So with yin tong, that's going to be this one right here. We're going right between the eyebrows. You can use one finger, you can use 2. If you use an eraser, it probably will leave a little mark. Index finger. So you're pressing, try to be better with my posture. Pressing right here. And then we're breathing in. Then we're breathing out. Now this one in particular is just steady pressure on the brow bone, right between the two eyebrows. We're not really guiding it in any particular direction. We're not swirling it. We're just pressing. I'm going to hold this one for a minute. While this point isn't inherently a neuropathy point in any way, shape, or form, I find it's helpful to still include points that are grounding and calming as part of any protocol that I'm giving people. Okay. Now, as I move from this center point, we're going to move down the arm and onto large intestine 11. Now, large intestine 11 is typically tied to the point here. So what we're going to do is do this point and then this point. But first, we'll do this on both sides. So large intestine 11, you go to the outside of your elbow, and you're going to the nook that's just diagonal in here. You can see that. And then we're pressing there. Now with this one, you can press like down and away. You can press directly on it. I find it's another one, and that's why I didn't do a directional arrow. I find it's another one that you just press directly for a minute or so if it's tender. You might, with this one, feel some tingling down the arm. The channel itself comes down the arm and then spreads into these fingers. We're going to hold this one for another minute. And then switching to the right side, we're going to do the same point. So on this side, it's like halfway in between. Right in there. Now I'm using my thumb. You could also use your index finger. If you were using this, you would be going like right here and then pressing. Again, you don't want to press too hard. You're not trying to leave a bruise, especially if your body, if your platelets are low. You don't need to be causing bruises. And if you have lymphedema on a particular arm, so you would be doing lighter pressure. So instead of that, you might be pressing just like a little divot. Depending on how your lymphedema is, you don't want to leave like pitting that doesn't go away. I've also had patients where if I know myself, I have lymphedema on my lower limb, so you could do gentle, like just gentle rubbing at the point too, versus pressing, just on the arm that has impaired lymphatic flow. Okay, now stomach 36. So I can pop up. I don't know if I could do this on the floor. All right, so this point, you're coming, if you look at the picture, you're coming right up to like the eye of the knee, and then you're going down diagonally. It follows the, I don't think I can get my pants up that far. It follows the shin bone. So you can follow the shin bone up, and then when the shin bone starts to go this way, you go right up under it. There's usually a spot that's a little tender. It does tend to be tingly when you press it. Not always, but sometimes. And you're going right in there. Pressing. This one's another one that sometimes it's hard to maintain pressure for the full time. So this is sometimes easier. And you're just holding. Okay, I'm going to switch to the other side. Switch. So same thing. Is everyone finding this one okay? I feel like it's like week 1 when I was trying to explain the one behind the neck. It's a little hard to find. So I'm following the shin up. And then as it kind of triangulates, I'm coming up to the nook, and I'm just finding the area of tenderness in that area. And I will say, even with finding acupuncture points on patients, I tend to go with the area that's tender versus the area where maybe the point on the chart would say it is. So you can find the tender point in the area. There's no wrong answer. And then for me, I get a little bit of tingliness down into the tops of the feet, which is where the channel goes roughly. But like I said, I have lymphedema on both my lower limbs, so I have to be careful with how much pressure I'm doing with certain points. Incidentally, stomach 36 is also sometimes really good for helping with appetite too, which I didn't mention in nausea, but it's another one that's good for that. Okay, so we started here. So the first cycle was here, and then here, large intestine 11, and then stomach 36. The next cycle of what we call chi is going to be large intestine 4 and liver 3. So large intestine 4 on the picture up here is right in that nook between the thumb and the index finger. And on here, so you're finding the carpal bone right here. And then you're going halfway between it. So my middle finger, you're going halfway between it. And then you're pressing. That's helpful. And I'm starting on the opposite side like I usually do. I'm sorry. There we go. Left side.
You just got a question. Oh, sorry. We just got a question. Does it matter if you start with your right or your left side?
No, I'm left-handed, so I start with my left, but probably everybody else starts with their right side. I think for me, the importance is consistency. Not because you're going to mess anything up, but because you might forget to do both sides if you don't do it left and then right, or right and then left. From a cycle standpoint, it is nice to have the flow of energy be consistent in one direction. So whatever you start with to continue with, but it doesn't matter what you start with. Okay, I'm going to switch sides. So same thing, going here, here. Now, you could use this eraser, not the point, but the eraser. That one for me is a little too tingly, so I'm going to switch back to my finger. And then I did put an arrow on this one, so if you want, you don't have to. You could leave it center, but you could kind of massage it a little bit from the thumb to the index finger, or to the hand bone, carpal, but you don't have to. Okay. That 2 points are tied to liver 3. Liver 3, I'm going to take my shoes off. It must be warm outside because the air conditioning has been on a lot. All right, let me back up. So this point is right between these 2 toes. So you're tracking. So with this one, you're tracking right on the top of the foot between the big toe and the second toe, and you're pressing toward your toes. So you're coming here, and then you're pressing. Sometimes you can press out toward your toes. Sometimes you can just press here. Again, I get lymphedema in my feet, so I don't press it anywhere out, but I just press at the point at a pressure that's comfortable for me. And then I took my garments off to do this. Usually I wear, I have up to my knees. Okay, let me switch. Do the other side. There we go. Oh, and I don't think, if anyone hasn't asked, but if you have a port, you can still do this bilaterally. It's fine. It's not contraindicated. And if you've had an IV or something like that, the only thing I would say is just be careful of large intestine 4 if you've had an IV in this area recently, just because it might bruise a little more easily or be more sensitive.
You're saying this is for lymphedema. Does that mean also neuropathy?
No. I have lymphedema. And someone asked the question about how to do acupressure with lymphedema. This protocol is for neuropathy.
Okay, thank you.
Yes, no, absolutely. Lymphedema, I refer all the time. Lymphatic massage, garments that fit you. Great. And then some lifestyle modifications.
Do you know why you have lymphedema?
Mine is after the birth of my first son, but then genetically, I've always had a fluid retention issue in my lower limbs, but it did not regress after having children. And it was like, it's amazing how large it can get. It got like up to here. It was like my entire limb. And I do have to wrap them. I'm going to switch to the last one. I do have to wrap them in the summer and wear like layered garments to keep everything in check. But in the off season, it goes down quite a bit. We start spleen 6. So we did here. We did this, large intestine 11, stomach 36. That was the first cycle. Second cycle for neuropathy, large intestine 4, liver 3. It's called the 4 gates. Moves chi in the entire body. Last thing I want to end with, we started centered here. I always want to end with something centered for the blood. So spleen 6, it's called 3-leg yin. It's a good point for the feet. So we're taking 3 fingers at the ankle bone. I don't know if you can see that there. There's the ankle bone. You're taking 3 fingers above it, and then you're going to the area that's tender and pressing. Ooh, did it again. It's because I'm seeing the screen. Left side. Now I like to use my thumb because it's just more comfortable, but you could use your index finger. And again, you could use a pencil eraser. But I will say managing lymphedema symptoms can make an impact on neuropathy for sure. Okay, I'm going to switch to the other side. And then while I'm doing the last point, just like in previous weeks, feel free to put in things that you're interested in using acupressure for. We still have a few weeks left. I think on my radar, I want to put in something for hot flashes, maybe aromatase inhibitor joint pain. But please put in the chat anything else, and then we've been compiling it. Oh, migraines is a good one. Yeah, I could do a more focused headache one. Yeah, I want to make sure whatever I'm doing for you all is helpful. Oh, constipation's a good one too. Yeah. Yes, nausea, constipation, especially if you have nausea and then you take Zofran and then you have constipation and then you get migraines. Yes. Yes. Okay. We could work on all of that. Okay. Any questions before we end today? Is that a pressure question? Let me see.
Yeah, this question was how much pressure should be applied to each of the points?
Yeah, I think for those of you that have been here for a couple weeks, you feel what feels best for you. I want it to feel like it's active. I don't want it to feel like you're bruising yourself. Like I said, it's not a no pain, no gain situation. You want to feel firm pressure, maybe a little bit of tingliness, maybe a little soreness, but it shouldn't feel like you're bruising the points. And you want to be able to consistently hold the pressure without feeling like you have to like grit your teeth and bear it, if that makes sense. And then on the side of lymphedema or swelling, use gentle enough pressure that you're not causing pitting that remains in your tissue. So you want it to be gentle enough that you're not pitting, firm enough that you feel like it's active, but not so firm that it's uncomfortable, if that's helpful. Okay. For anything else that's in there, do you need to do ibuprofen?
Sorry, we did get this question earlier in the chat. This was for the nausea protocol. Do you have to do like the whole protocol or just the points for nausea?
That's a good question. You can do the whole protocol. If you don't have time, here, let me see if I can flip to it. Hold on. Okay. If you only have like a hot second, do the pericardium 6 one, so the point here, and the one on your foot. Or worst case scenario, just do the wrist point. So if you're getting acute nausea, say you're driving in your car or you're, in a work meeting, you can just press this point, massage it, and see if it's helpful. This point on its own is clinically indicated for nausea from any indication. Okay. So that's the quick and easy. Use this one for nausea.
And then this question was just, can you combine protocols or just do one at a time?
So the thing, if you're thinking about combining protocols, just for general, I would say do what we did the first week, which is the fatigue, this protocol. So these points that are on here. And then if you need to focus on any of the topics that we've been focusing on, do that protocol. That answers the question. I mean, you can mix and match, but the thing with acupuncture is we do try to create a treatment that has a little bit of outward movement, a little bit of inward movement, a little bit of upward, a little bit of downward. We try to balance the person. So if you're just looking for a combined, I would use this one. Okay. All right. I will hopefully see you next week. Maybe some new people, maybe the same people. And it sounds like slides will be available. Recording will be available. And anything that's in the chat, I always read tonight and then use that to prep what we come back with next week.